Hi, my name is Sophia Tuason, and for my critical assignment, I will be doing chronic obstructive pulmonary disease, also known as COPD. Chronic obstructive pulmonary disease, also known as COPD, is a chronic inflammation disease in the lungs that causes airflow to be constricted. I have decided to select chronic obstructive pulmonary disease because of the recent coronavirus pandemic and the increased smoking habit today. The recent pandemic has done a great damage to an individual's lungs if they were exposed and contracted it, and the long-term effects are still unknown. COPD is not curable, but their symptoms can be managed. There are two stages of COPD called emphysema or chronic bronchitis. COPD is the third main cause of death in the world and is the seventh leading cause of poor health in the world. Smoking and air pollution are the most common causes of COPD. And with the recent issues of global warming, smoking, and the coronavirus pandemic, many more people are at risk for COPD in the upcoming future. COPD and public health. The impact of health education and prevention activities to reduce the risk or manage chronic obstructive pulmonary disease has a great impact on the youth. Programs that advocate for no drug or smoking are high in primary schools. In hospitals and community centers, many advocate for environmental and personal health because smoking is a main factor for COPD and air pollution. Areas that need improved health education efforts are in secondary schools. Many adolescents are taking up smoking because it can be seen as looking cool. Many can be peer pressured into smoking and take it on as a habit. With the recent pandemic, the impact on individuals who smoke, they are at higher risk for COPD and other respiratory illnesses. I believe communities today need to have better prevention programs as there are many other respiratory illnesses that can affect others. The etiology of COPD is long-term smoking, inhalation or secondhand smoke from pipe smoke and cigar smoke, air pollution, fumes, dust, and overall genetics. The pathophysiology of the disease causes an imbalance between the proteases and antiproteases and between oxidants and antioxidants within the lungs. There's an increased mucus hypersecretion and ciliary dysfunction. Airflow obstruction and hyperinflation, which is also known as air trapping, also occurs in the lungs. Gas exchange abnormalities and pulmonary hypertension. The pathophysiology of COPD can also cause systemic effects known as cachexia, skeletal muscle atrophy, osteoporosis, increased risk of cardiovascular diseases, anemia, as well as depression and anxiety. The signs and symptoms of COPD are shortness of breath, wheezing, chest tightness, chronic coughs with colored mucus production such as green, white, and yellow, frequent respiratory infections, fatigue, swelling in the extremities, and unexpected weight loss that can be seen in the advanced stages of COPD. There are also risk factors for those with COPD, which are smoking or secondhand smoke, lung irritants like chemical fumes, family history with genes being linked to COPD, as well as history of respiratory infections as a child, such as asthma, bronchitis, and more. COPD is not curable, but the symptoms and signs can be managed. They can be managed through medicines with bronchodilators, steroids, antibiotics, as well as getting vaccines during flu season, pulmonary rehabilitation through exercises, supplemental oxygen or oxygen therapy with non-invasive ventilation. So some examples of non-invasive ventilation include a CPAP mask, a simple non-rebreather mask, venturi oxygen mask, as well as the nasal cannula. There's also endobronchial valve therapy, and in worst case scenarios, you can get a lung transplant, a lung volume reduction surgery, starting preparation for palliative care, as well as end-of-life care and hospice. COPD can be identified through a few procedures. The first one is spirometry, which is a breathing test, an arterial blood gas test, X-rays or computed tomography scans to measure emphysema in the bronchial wall thickness or air trapping on chest scans. And the last one is simple, which is a questionnaire about symptoms. There are various ways to improve health outcomes via education and prevention. One is maintaining a healthy weight and diet. Two is learning ways to bring up and release mucus. Three is to practice breathing exercises. Four, do water-based exercises. 5, using oxygen appropriately. 6, avoid respiratory infections. 7, improve air quality using air purifiers at home and humidifiers. 8 is to quit smoking. And 9 is to stay up to date on vaccinations, for example, the flu vaccine during flu season, to help prevent infections and build immunity. There are a few recommendations for those with COPD. One is to stay away from secondhand smoke, such as cigars, pipes, cigarettes, or chemicals, and dust. 2 is nutritional counseling. For people with COPD who have trouble eating because of shortness of breath or being tired, they are suggested to follow a special meal plan with smaller but more frequent meals, rest between eating, and taking vitamins and nutritional supplements. Exercise training is also one recommendation by physicians, as well as educating yourself on your lung disease or condition and how to manage it. Learn and practice energy conserving techniques. Do breathing exercises, as well as seek out counseling or group support with others that are struggling with diseases. The public health has strategies for COPD prevention. So the first one is to do surveillance and education for individuals that are at risk within the community. 2 is to do research and prevention strategies, comparing old data with new data to ensure that those who are currently struggling are learning and getting the best treatment that is available. 3 is to enhance tobacco control programs and COPD-related programs at all levels, whether it's national, state, and local, through the Department of Public Health. And the 4th one is to seek out support programs and policies that help reduce COPD. So a couple examples would be no smoking indoors or outdoors. They have a smoke-free policy. Workplace air quality assurance, resources for screening programs for those at-risk workers and families, as well as insurance coverage for evidence-based smoking cessation treatments. In conclusion, from a public health perspective, there are many factors that can affect the health of one's respiratory system. Chronic obstructive pulmonary disease is one of the top 3 causes of death worldwide, and more attention should be brought to respiratory illnesses, especially with the recent events of the coronavirus pandemic. This is one of the disease conditions whose prevalence is rising due to the fact there are no treatments, but the symptoms can be managed. Here are my references. I hope you found today's presentation to be informative, and thank you for listening. Bye, everybody. Take care.